Hey everyone, this is Friday again, the Q&A Friday. We have 3 questions today. First one comes from Jean Moran Hirth. Hey Jean. She asks, as a person living with managing lupus, should I ever limit protein? And with low-dose Plaquenil, a little medical marijuana, and lots of your suggestions, I'm feeling much better. I started weight training 2 months ago. I like it. I'm feeling strong. The trainer recommends lots of protein, 26 grams, about 3 to 5 times a day. Is that okay for me? I've not had lupus kidney damage that I'm aware of. Well, that's awesome, Jean. And yes, too much protein can be acidic, and that's way too much protein. But remember, there's protein in vegetables like kale, spinach, broccoli, peas, and other non-meat sources, even like quinoa, nuts, seeds, and beans. So I want you to refrain from getting them from conventional meats, right? Those that are non-organic. Rather, if you're going to eat meat, choose the organic non-meat options. And if you're not on an elimination diet, which I recommend you cycle every 3 to 6 months, then eggs are a great source of protein. So I'm opposed to getting down to counting calories or grams of proteins and whatnot. I would rather you listen to your body and incorporate all the great protein sources that I mentioned. And if you're full, then stop eating. And as a general rule, if you were to have straight up protein from meats, then the portion would be about the size of your palm. And eating shouldn't involve calculations and metrics. Rather, cultivating awareness in your body from your own experience. Remember too that vegetables, grains, nuts, seeds, and beans also contain not only the protein, but fiber, carbohydrates, as well as protein, right? As well as other essential vitamins and minerals. So it's really hard to break food down to the grams of getting this, of how much protein and so forth. So I hope this helps. I find that a lot of people like to complicate matters like that when you break it down. And so you get so overly focused on the grams, and I don't want you to do that. You're doing a great job, but for this one, I wouldn't listen to your trainer, okay? Number 2, a second question, comes from Nancy Losbacho. She says, hello, I'm new to this group and I'm happy to be here. My question is this: does anyone have suggestions on how to manage pain? I'm in a flare right now and have terrible pain. What has worked for you? Well, pain is due to the systemic inflammation in our bodies. Inhibiting the inflammatory biochemical pathway is the way to go. CBD oil, even medical marijuana, like Jean mentioned, high dosages of curcumin plus therapeutic dose of good quality fish oil are good options to supplement with, as well as to follow the elimination diet under the files in this group. Doing gentle yoga classes that I post on a regular basis can be also helpful too. All these things will collectively help you. We have the above mentioned supplements on our website or on our shop store, lupuspharmacy.com with an F. The link is provided below. The last question comes from Cheryl Ann Asher. She asks, why with lupus do you have positive ANAs and other times you don't? Many people wonder why. Is it due to the flares? I have one friend who has 6 positive and negative results. And everyone is different, I know, but that's puzzling part of lupus. I have it too, but have always tested positive to some degree. So remember, Cheryl, 2% of lupus patients do have a negative ANA, but generally speaking, 98% of us with lupus have a positive ANA. This is why other lupus markers are measured to understand the overall disease activity specific to you. I would highly recommend a VISE testing to make sure that you do indeed have lupus, as they have a highly specific marker that can help. Also, they can rule out other autoimmune conditions. So ask your doctor. That test is a VISE. We're going to go ahead and create a link below as well. So with that, over here in Georgia, it's going to be very pretty weather. So everybody who, if you're a mom, happy Mother's Day and have a great weekend. And I'll see you guys next week.